I am Dr. Sharda Jain. I am Director of Life Care Center. I am also the Secretary General of Delhi Gynecologist Forum. And our mission is Cervical Cancer Free India. So let's talk about cervical cancer prevention. This talk of mine is dedicated to my teacher, Professor P.K. Devi, who brought the interest in me to work on this area. With her effort in the last 10 years, my special thanks to Delhi government that free vaccination is being offered to the girls who are 11 to 13 years in 2 hospitals free of charge. Unfortunately, still it has not come to the schools, and the children have to travel to these hospitals to get a free vaccination. Secondly, I am also grateful to Delhi University that they have made it compulsory that this vaccination of HPV should be taken, and they are not promoted to their second year unless they have taken the vaccination. So my hats off to them. I very strongly believe a cancer which can be 100% preventable, and the cervical cancer is the only cancer between a man and a woman which is 100% preventable, then why talk of cancer treatment? At this particular stage, the cost is peanuts and advantage are so great. Each and every citizen of this particular country should join this particular mission to say no to cervical cancer. Recently, the study has been published by ICMR in Lancet, which shows that the breast cancer is increasing in this country, but cervical cancer has shown a decline in last decade. A decade earlier, this was #1 cause of cervical cancer. Same study was found by the Tata Cancer Hospital, and they also found that the cervical cancer is decreasing in metros. However, it has remained the same incidence as far as villages are concerned and as small towns are concerned in this country. What is the basis of prevention? The basis of prevention is, the base of this pyramid is made by vaccination. If you take the vaccination, then 45% of the disease burden can be brought down just by vaccination. The secondary prevention is that you are trying to detect precancerous lesion early. If it is treated, it offers 100% treatment, and thereby the cancer cervix is prevented altogether. So the 2 things are very important: vaccination and regular screening. It is my request to all gynecologists, lady doctors, nurses. Stephen Hawking said, the biggest problem is illusion of knowledge, knowing that I know everything, when the people are really not knowing anything. Once you know that I do not know, then it is very easy to learn. As far as India is concerned, हम हर चीज की गढ़ हैं. हाइपरटेंशन की भी गढ़ है, हार्ट अटैक्स का भी गढ़ है, उसी तरह सर्वाइकल कैंसर. We contribute 1/4 to the kitty of occurrence of cervical cancer, and likewise we contribute to 1/4 to the total number of deaths occurring as a result of cervical cancer. In today's time, there are every 2 minutes one death is taking place because of cervical cancer, and as far as India is concerned, now every 8 minutes we are losing a woman as a result of cervical cancer. One Airbus full of 200 people is crashing every day as a result of cervical cancer deaths. and still the government is not spending any money on it. There has been a promise, but nothing has started as yet. As far as incidence is concerned, the total incidence in this country has come to 11 per lakh cases. For a breast cancer, it is 11.5. For cervical cancer, it is 11.1 per lakh cases. But if we have brought down the maternal deaths in this country, if the gynecologists, lady doctors, nurses put their effort together, then we can definitely have cervical cancer-free India. Another thing which we must get worried about it, that we lose ladies as a result of cervical cancer in the prime of their lives, when the family needs these ladies the most. The biggest risk factor is HPV. And the person who associated cervical cancer with HPV infection got the Nobel Prize. He got the Nobel Prize by detecting the strains which are oncogenic. There are 15 out of 200 viruses which are oncogenic and which we need to pick up early to find out who are the persons who are at high risk. According to him, the cervical cancer does not occur in case if the patient has not had the presence of HPV DNA in their cells to develop cervical cancer. We know this HPV 16 and the 18 are the worst, they are high risk category, and 75% of the total burden is caused by these two viruses. While genital warts are caused by 6 and 11. The USP of cervical cancer is that this is slow progression is seen. It takes 10 years from a pre-malignant stage to reach to a malignancy, is minimum 10 years, and that gives enough time for gynecologists to pick up the disease early in a precancerous stage when it can be treated early. At that particular time, as I said earlier, the treatment is very effective, almost to the tune of 100%. As far as LSIL is concerned, low grade lesion, it includes HPV infection and CIN1, while the high grade includes CIN2 and CIN3. Now, for any cancer screening program for the country, that particular disease should be highly prevalent and we should have methods that can be simply detected by people. There are two terms which we need to know. One is specificity, another is sensitivity. Specificity in simple terms means मुझे बीमारी नहीं है और मेरा टेस्ट नेगेटिव है. Sensitivity means मुझे बीमारी है और मेरा टेस्ट पॉजिटिव है. The specificity is more important than sensitivity. And it is a success story that cancer service screening program have done wonders in the Western world wherever it is used in the last 50-60 years. It has brought down the incidence of cancer cervix to 70% and deaths have decreased to the tune of 80%. If they can do it, we can also do it. Now, what are the things which are used? For screening program, we require cytology. That means a conventional pap smear or a liquid-based cytology. Both these names you have heard it very well. Both are equal. And the second is HPV testing. Out of the 200 viruses, 15 viruses are oncogenic, and we have the test now that this HPV high-risk DNA panel can detect those 15 viruses whether our system has it, they are present or not. Cytology in the last 50 years has developed very well, and now there is no confusion among two pathologists to detect the same. Whatever one pathologist says, the second pathologist also speaks the same. Now, as far as our country is concerned, only 2.6% cases are screened. it is not even tip of the iceberg. When we say tip of the iceberg, at least 10% population should have been screened. But that's not so. And it's my humble request to the Government of India and to the lady doctors across the country to see to it that उनको कमर कस लेनी है इस particular इस cervical cancer को खत्म करने के लिए. The revealing part is that if you give the vaccination, they are Indian studies, if you give vaccination, the disease burden can be brought down to 45%. And if you only screen them for pap smear once at the age of 40 years, the disease burden can be brought down by 13%. If you do it 3 times, that is at 35 years, 40 years, 45 years, the disease burden can be brought down to 30%. But if you combine the both, the disease burden can be brought down. If you screen once and give vaccination, it can be brought down to 53%. And if you do screening for 3 times and give a vaccination, it can be brought down to 60%. So the vaccination is very important, and you don't require any screening prior to that. Sexually active women, the ladies who with abnormal cervical cytology should also take vaccination. Now, since 2013, we have global cervical screening guidelines available. It means all over the world the same guidelines are used. These guidelines very specifically tell when to start screening, that is 21, when to stop screening, that is at 65, what should be our policy after hysterectomy, and what should be policy if the patient has had vaccination. One thing is very clear, the screening should not be done for people who are less than 21 years, because the experts feel whatever is the age of having a first coitus, she will not have invasive cancer till the age 21 years. These are strong recommendations. From 21 to 65 years, there are 2 options. One option is then you can use the cytology, that is conventional pap smear or a liquid based cytology, and if it is negative, the test can be repeated every 3 years. There is no point doing HPV testing along with cytology earlier than 30 years, because HPV is seen in good 80 to 85% patients who are less than 30 years. So after 30 years, the strategies are 2. If you are using the cytology and if it is negative, then every 3 years the test has to be done up to the age of 65 years. In addition, you can do an HPV co-test, that means cytology plus the HPV high risk DNA panel has to be done, and if both the tests are negative, in that particular case the test can be repeated every 5 years and not yearly as we were doing before. Now what should we do in case the age has reached 65 years? Things are very simple. If you are doing the cytology, in the last 10 years 3 cytologies should be negative. And in case if you are doing an HPV co-test, that is cytology plus high risk DNA panel, then the 2 tests should be negative. What should be our policy? In case if person has had HPV vaccination, it is to be age specific. If I am 28 years old, cytology. If I am 35 years old, I can have cytology or HPV DNA testing depending upon what is my age. The screening has to be done up to the age of 65. Please remember, if you have CIN2 or higher grade lesion, then you need to be followed up for 20 years. Strict follow up has to be there for a development of cancer. There is no compromise on it. So, my request with the folded hands is, see to it that you are vaccinated. At this particular time, the Government of India is not giving it free. Only the 3 states it's being done. In Delhi, It is given free to girls of 11 to 13 years. In Punjab it is the same. In Telangana it is the same. Once they are exposed to sex, they should have a regular screening done for a presence of cervical cancer or precancerous lesion from the age 21 to 65 years. If you do these things together, please see to it your wives, your mother, your sisters, everybody should go through this screening program. If they're not doing it, it's the duty of each and every citizen of this country that they start doing it. Thank you very much for patient listening.